Hi, my name is Allie Stoddard, and I'm doing this video for Dr. Pam and her patients at United Pharmacy. And I have a vast background in spine, back surgery, oncology, orthopedics, and pain management. And I've done over 2,000 hours of nutraceutical, nutrition, and alternative medicine. I work with a company. My company is called Green Alley, CBD.com, and Dr. Pam offers CBD from the hemp plant from my company. So I am the owner and founder of Green Alley, and I'm going to show you today how you can boost your immune system so you can fend off a virus, a bacteria, an autoimmune disease, or whatever. Today, COVID-19 is affecting many of us in the Bay Area, and I want to help you boost your immune system. The first and foremost thing that we can do that's most important is look at our vitamin D levels. Vitamin D has a huge correlation with different disease states. If you are deficient in vitamin D, you may be more susceptible to catching the coronavirus. You may be more susceptible to getting breast cancer, bone issues, ADD, and depression. So vitamin D is hugely important. And when you take a vitamin D supplement, whether it's prescribed by your doctor or not, it should be vitamin D3 because that's the most bioavailable form. And then there should be another vitamin that goes with it called K2. Vitamin D3 plus K2 should come in one pill. So we gotta up our vitamin D levels. Everybody, almost everybody in this country is deficient in vitamin D, and we're seeing that in our COVID, in our cancer, in our autoimmune, in our mood disorders with our children. So vitamin D is a huge deficiency. Get it checked. It's a blood test. You can ask your doctor, or you can go to grassrootshealth.net and they will send you a home kit for $79. You can prick your finger, put a little bit of blood on their little form, and then send it in the mail. It's as easy as that, but it's very important to get your vitamin D tested. The other thing I talk about with boosting your immune system is vitamin C. And then foods. We all talk about foods, but organic, because the pesticides and the herbicides that we use in this country are neurotoxins. That means that they're toxic to the brain and to our spinal cord. This is a spinal cord. It comes from the brain. The brain has these nerves that go all the way down to the back of your butt. And then the nerves go out each level. And so when we have carpal tunnel, that nerve starts in the back of the neck. So when you use a pain cream or a CBD cream or something that you get from the pharmacy, not only do you want to put the pain cream right here, but you want to put it in the back of the neck because that's the beginning of where that nerve starts. Okay? So I'm going to talk to you a little bit about CBD. And CBD is a sister plant to the marijuana plant. It is not marijuana. It is not pot. You can go to the dispensary and get CBD. That is marijuana. That is pot. That is a Schedule I drug. Everything that Dr. Pam sells at the pharmacy and that I have on my website is CBD from the hemp plant. That's a sister plant. It has no THC in it. It cannot get you high. And it's a dietary supplement, which means it's a nutraceutical, a vitamin. What I sell on my website, what Dr. Pam has in the pharmacy, you cannot get at the dispensary. Okay, so I have 8 patients so far that we have helped through COVID. Now, the symptoms for COVID are scratchy throat, coughing, fever, lose your sense of taste, lose your sense of smell. By the way, those 2 things, a sense of taste and a sense of smell, are usually because of a vitamin or a mineral deficiency called zinc. So I'm going to be talking to you about my research that I've done. There are many critical care doctors here in the United States that have come up with protocols, successful protocols, that you can do on your own at home, and you don't have to go to the hospital. And I have 8 clients who started out with COVID. Some of them had progressed to where they got a lot of inflammation in the chest and they couldn't breathe. All 8 of these clients that I helped with CBD and vitamin D and zinc and vitamin C, all 8 of them turned their symptoms around in 1 to 2 days. We know that zinc kills a virus. There are 2 studies now, one in Israel, one in Canada, showing that CBD, just by itself, not the marijuana you get in the dispensary, but CBD from the hemp plant, is more effective than the corticosteroid dexamethasone that they are using in the hospitals to treat COVID. So we know CBD is a huge anti-inflammatory. It is more potent than many of the steroids or the corticosteroids that are out on the marketplace today. So COVID starts with a tickle or a fever or something in the throat, and then goes to the lungs and creates a lot of inflammation. That inflammation is a hyper response of our immune system. So when we take CBD in, that CBD jumpstarts a system we already have in the body that helps the immune system. It's called the endocannabinoid system. The endocannabinoid system is looking for cannabinoids to strengthen it, build it up. And if we can jumpstart this system, then the endocannabinoid system can help the immune system kick out a virus, kick out cancer, reverse an autoimmune disease, reverse diabetes. Now, all of these things can be helped with these supplements, but you also need to change your diet, okay? When we have a virus, you have to hydrate a lot. You have to drink at least 8 ounces glasses of water a day, at least, okay? You have to sleep a lot. But when you sleep, elevate your chest and maybe sleep on your stomach. Move around a little bit so the fluid doesn't pool in the lungs, okay? Hot. We have a fever because our body is trying to kill the virus. Don't stop the fever unless the fever gets to, I think the doctors say 102 degrees. By the way, I am not a doctor. I am not a nurse. This is not medical information to prevent or to treat or to control or to diagnose COVID or anything else. I'm giving you an educational video to help you boost your immune system and have a better response to everything, including a virus or a cold or the next thing that's going to come down the pike, okay? So based on the Math Plus protocol developed by New York critical care doctors for COVID, based on Dr. Mercola, based on Dr. Blair, and I will put these in the video notes. This is my protocol for COVID. The first one is to maintain your immune system. It's a good anti-inflammatory, boosting your immune system type program. Okay, the first one is 5 to 10 milligrams of CBD, and that's CBD from the hemp plant, and you want cold processed. You don't want something that has been added to chemicals. You don't want something that's been heated up. There's a lot of bad CBD. Dr. Pam has CBD, okay? The second one is vitamin D. If your doctor doesn't prescribe it, which you don't need a prescription, you can get vitamin D3 plus K2 over the counter. 10,000 units of vitamin D3 plus K2. 30 milligrams of zinc. We know zinc kills a virus. When you take your zinc, take it with your CBD. CBD and zinc go together, because if you do, then the CBD gets the zinc in every cell of the body. That hasn't been proven, but Dr. Blair elucidates that in his training videos, and I will give that to you as well with the references. And then the last thing, vitamin C. Vitamin C is very important for boosting the immune system. So as a maintenance, 2,000 milligrams a day, and it's better to take 1,000 at a time. Take 1,000 in the morning, 1,000 with dinner, okay? CBD also, you should probably take twice a day, okay? We eat up our CBD on an 8-hour to 10-hour basis, so you want to replenish that at least twice a day. Now, COVID, if you are symptomatic, you have a fever, you have coughing, you have phlegm in your throat, you have horrible joint pain, horrible back pain, that's what we're going to go to next, okay? We bump it up to 15 milligrams of CBD 3 times a day. 50,000 units of vitamin D a day, and that has to be with food and fats. Vitamin D is fat soluble, meaning you can only absorb vitamin D if you have fats with it. It will absorb, it will attach to fats. If you take it with your orange juice in the morning, you're not going to be absorbing vitamin D, okay? Next thing is, let's see, the next thing was, 60 to 200 milligrams of zinc. If you lose your sense of smell and your taste, then go on the higher side of 200 milligrams of zinc a day. If you don't, 30 milligrams twice a day of zinc, okay? And then the last thing is vitamin C, 2,000 milligrams of vitamin C 3 times a day. That means it's 6,000 milligrams of vitamin C, okay? Come to askgreenalley@gmail.com for questions. Ask Dr. Pam. And there's lots of questions. There's lots of different iterations of this suggestion that Dr. Blair and the Math Plus people have. I'd be happy to help you with them. I've got many physicians who are using this program, and I have quite a few patients who have done very well with it. So send me an email if you have questions. Thank you so much. Have a great day and be safe.